Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Wellness Center, where lives are changed every day through the natural approach to health care. Today's show is about putting the pulse back in your life through External CounterPulsation Therapy, or ECP. And Dr. Prather, what does ECP stand for?
Well, ECP stands for External CounterPulsation, which is a therapy that's actually been around for over 40 years.
Wow.
But it's actually not that well known about. And we wanted to do this segment during February, which is Heart Month.
Heart Month. February's Heart Month.
And the external counterpulsation is specifically for the heart.
Okay. Well, what are the benefits of, and we're going to refer to it as ECP, that stands for External CounterPulsation Therapy, but what are the benefits of ECP?
Well, the main problem with, if we had a design flaw, it's that when the heart actually beats, it oxygenates the whole rest of the body. When the heart actually relaxes, it gets its blood supply back. But there's a problem when you actually are doing the heart, is it doesn't get enough oxygen under normal type of beating. You have to actually have aerobic exercise to be able to get enough of a blood supply back to the heart. And unfortunately, modern Americans don't get enough aerobic exercise.
And you said modern Americans. Was there a time we were getting more aerobic exercise than we do now?
Absolutely. When we didn't have automobiles, there was always, a lot of walking, running, horseback riding, to get any place that you went. So people automatically got the cardiovascular aerobic exercise that they needed. When we talk about diet, we talk about a lot of the different types of aspects of cardiovascular disease. But they did a study of the Maasai in Kenya. They have a very high-fat diet. They take a lot of, basically their diet is exactly the opposite of what you're supposed to eat to have good cardiovascular health. And they thought for sure that as they studied these people, that there would be a high incidence of cardiovascular disease, but there wasn't. Now, what was the difference that, that they had was that they were constantly walking. There was a heavy amount of aerobic exercise that was going on, and aerobic exercise has been proven as the panacea to cardiovascular disease.
Yeah, and we're sitting at desks a lot more.
Our
sedentary.
Sedentary lifestyle, we don't go any place except in the car. We sit at our desk. There's very little aerobic exercise that we actually do. And there is an oxygen debt that actually starts to develop with the heart. And when you have that oxygen debt, there is cardiovascular disease that starts to work. So, if you look at the remedies for almost every cardiovascular disease. They have the gold standards. The British Journal of Medicine puts out, what actually works, what doesn't, which pharmaceuticals, which type of things have been proven to be helpful along any type of disease process. As they mention, any cardiovascular disease, they always put down as the number one thing that has been proven to actually prevent and to reverse cardiovascular disease is aerobic exercise. And that's what the External CounterPulsation Therapy unit is. It is an aerobic exercise machine.
Well, how does the ECP work?
Well, describing it, it's like a big blood pressure cuff over the lower part of your body. So, we talked about the heart. When it beats, it oxygenates the whole rest of the body. When it actually goes into relaxation, that's when it gets its oxygenation. So what the ECP does is it actually times itself to when the heart actually goes into relaxation. Then there's like a second heart down in your legs, where there's a compression from the cuffs that go across the legs and up into the pelvis. and it actually brings up about 10 times more blood than would normally, even during aerobic exercise, get to the heart. And then you have a superoxygenation of the heart.
Now, at this time, is the heart being monitored?
Yes, absolutely. The heart is actually being monitored by this equipment. It's all computerized so that it actually times itself perfectly with the contractions and relaxations of the heart. It's actually being monitored, and if there are any problems, then there's an automatic stop on that.
Mm-hmm. So are people laying down, reclined?
Yes, there's actually, it's a big table, actually pretty comfortable. Mm-hmm. So they hop up on there, and there are actually several different positions that they can
Do they have to hop on it?
Well, in other words, it's an easy type of a process.
Right.
It actually goes up and down.
As they're getting the treatment, they're going to hop on it.
Yeah, they're going to hop on it. And then we do have people that don't hop, that get on that. That's absolutely true. We hook them up, and we actually have several different positions for them. Mm-hmm. Whether they need to sit up, because we have some people with severe respiratory problems along with that. Mm-hmm. We have some people who prefer to lay flat and take a nap. So it is actually adjustable on the positioning on that. Now, as people first, you're starting to get used to it, and it might sound a little uncomfortable. But after about 2 or 3 visits on that, most people actually fall asleep while it's taking place.
I can vouch for that, yeah.
Yeah, you've been on that. And it does have as you get that oxygenation to the system, there is a tremendous amount of relaxation that actually occurs with the body.
Mm-hmm. Well, who should have ECP therapy?
Well, the different types of things that are actually utilized for it that have been found to be effective for ECP is anyone with heart pain. Mm-hmm. The main reason that you have angina, as it's called, heart pain, is because you have a lowered oxygenation to the heart, and there is a pain that's actually occurred on that. So the results on the reducing the heart pain are actually quite dramatic. The percentages as it looks at that. The amount of relief along those lines is reaching almost 90%. The other things that has been proven for the ECP is congestive heart failure. That is a disease process that has extremely low reversal chances with modern medicine at this point. And we have had absolutely amazing types of reversals with the ECP. We had an Amish gentleman who had come in who his heart had actually gotten twice the size of what it normally should be, and he just was into type 2 diabetes, overweight, and his doctor had said basically there wasn't really too much left to do. So we started him out on the external counterpulsation therapy, and about halfway through, we were talking about some of the changes that he's experiencing. One thing he said is he had split a whole truckload of wood, if you remember that.
Right.
And
it's his livelihood.
And he had not actually done that for 15 years. So, he had not been able to. So all of a sudden he had seen a real big difference. And after we had finished the whole external counterpulsation therapy with him, we had his heart rechecked by his cardiologist, and it had actually gone back to normal size. The heart is extremely regenerative.
That's encouraging.
Yeah, it actually, if you can get the oxygen to the heart, get the nutrients in there, start to get that turned around. Even when we have had areas where people have had heart attacks and there had been dead areas of the heart, there have actually been very well confirmed in our patient base total reversals of that. So we've been able to see congestive heart failure reversed. We've seen people who have had heart attacks. It was almost like a heart transplant. for each one of them. So, being able to regenerate that instead of actually getting a heart transplant, which is a little difficult on you, this is a whole lot easier.
Right.
You can actually remake your heart and get it back to where it needs to be.
So you said some of the things the ECP benefits and those that would benefit angina, congestive
heart failure, hypertension, type 2 diabetes. There's actually a physiological change that occurs on the cellular level when you're actually doing the ECP. There is blockages are reversed. The different types of things that we see with the changes in the heart, arrhythmias corrected, both atrial and ventricular. Arrhythmia is actually fixed. And when you can actually get the oxygenation into the system, the body can actually reverse a tremendous amount. Now, that may not be the only treatment that people need for the heart, but it is something that is just universal, that the heart will respond to the oxygenation, and the body will actually heal itself.
Yeah, that's real encouraging to hear how it can just regenerate.
Absolutely. And that was actually a surprise to the researchers on how well it actually regenerated, because that wasn't actually at one time thought that could actually happen.
Okay. Well, up next, we're going to be talking about the benefits the ECP has, what benefits the heart gets from the ECP. How would you like a free 60-minute massage at our relaxing spa at the Prather Wellness Center? Each month, we have a random drawing and give away a free massage to one of our lucky Facebook fans. Just hit the like button on your Facebook page, which you can find at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of Meridian Health and Wellness. In honor of National Heart Month, Meridian Health and Wellness is offering a full heart evaluation at the special price of just $85. Dr. Prather, what 5 tests will be included in the heart evaluation?
EKG, a Doppler spirometry, acoustic cardiograph, and a cardiassess.
Can you tell us a little bit about each of those tests?
Certainly. The EKG, everyone is aware that actually measures the electrical current around the heart. Very important type of a test along those lines. A Doppler is actually there to measure the blood flow, to make sure that there isn't any blockages in the arteries. And then also we have a spirometry testing, which actually measures the lung function to make sure that the respiratory component is actually working. Acoustic cardiograph actually measures the valves of the heart, which is a very important part of the functioning of the system. And then also we have something called a cardiassess. And what that measures is your cardiorespiratory efficiency, how well you can actually process and utilize the oxygen in the body and getting rid of the carbon dioxide. It's a very important test and actually a very good indicator of the health and well-being and the chances of a cardiovascular problem that might occur.
And who should get the heart evaluation?
The heart evaluation should be done by anyone over the age of 50. That should
men or women?
Men or women should actually be getting that done to see who might be at risk, and that should be something that is recommended on an annual basis.
Mm-hmm. So that $85 includes 5 of these tests?
All 5 of those tests. It does take about an hour and a half to do those, but very, very important and something that we would like to really promote because, of course, cardiovascular disease is the #1 killer. And for you and your loved ones, that's one of the best things that should be done.
And then you review the tests with them
at a different date. And
that
also includes a review of all the findings on that.
Okay. Well, arm yourself with information on how your heart is performing and discover any possible precursors that require further attention. Schedule your full heart evaluation at Meridian Health and Wellness,